Welcome on behalf of the board to our town hall meeting. We are planning 3 of these this year, and this is the second one, and they will all be conducted virtually due to the COVID-19 virus. Our first one was held in May, and we do plan a third one later in the year. We have a number of board and staff members with us online today, though only 2 of us are visible to you. You will find brief bios and photos of all the board, staff, and volunteers on our website under Meet the Team. Your co-hosts today are me, Laurie Gillies. I'm Vice Chair of the board and a member of the Communications and Strategic Planning Committee, and Dr. Sabrina Saunders, who's our CEO.
Hello.
Sabrina and I will give a bit of background to start and hope that you will be able to ask questions of us. You can do so via the comments section. And just so you know, comments are public and will appear with your name. We will try to get to all of your questions during our session today. Our timing is about 30 to 40 minutes, but you'll also be able to access this town hall as it's being recorded, and you'll be able to get at it on YouTube not long after we're finished, actually. So as for the structure of the session, we'll be providing an overview of our current service model under the current COVID restrictions, addressing how the Ellie Shore and the Craigleith Heritage Depot are being handled, since the buildings are very different and physical distancing is a critical issue. We'll also talk about what happens if we have to move backwards in response to further COVID restrictions, what will trigger such changes in our service model, and what steps we think we would be taking as these things happen. There may again be a difference between Shore and the depot, so we address these 2 locations separately. We'll talk a little bit about the budget, how it's structured, what's the process. We'll talk about board meetings under COVID and how the community can participate. And we'll talk about the COVID alert app. So remember, you can put your questions into the comments and we will respond to them. And so now I'm going to pass this on to Sabrina.
So just a brief overview of some of the service model. We opened here at Ellie Shore on August 18th, and then we followed with the Craigleith Heritage Depot on August 30th, and that was for library services only. We did promise that the depot would be opening shortly thereafter, and we are looking to do that announcement coming in the next few days. We're looking to be able to open the depot for a larger service provision of museum and research in the middle of October, probably just after the Thanksgiving holiday. So we will continue to have a hybrid approach to all of our services. So book service, connectivity, and PC use will be on site at both of our facilities, but all of the programs are going to continue to be virtual for the foreseeable future. If you've been watching the news even today, we know Ontario has hit its highest numbers since the beginning of the pandemic. Both Thornbury and our surrounding areas that we have articulation agreements also have growing numbers. So we are going to continue to err on the side of caution and try to keep our community as healthy and safe as we can. So like I said, CHD is going to be opening soon for the full walkthrough. We've all been waiting for this day. The depot closed totally unrelated to the pandemic on October 23rd of 2019. So it has been a while since you've been able to visit the museum side of it. So we're now opening sometime just after Thanksgiving. And like we did with the Ellie Shore opening, we are going to have a video. So the video will walk through how you can access the site, what the procedures will be. And just to give you a snippet, we are going to be having 3 different zones in the building. And that will be our entry foyer, which is the library section, our main area of the museum, which will be the gallery collections for the museum, and then the research room down the stairs will be able to have research people coming in to do work. And by having those 3 zones, we actually can have multiple groups accessing the depot at different times and still maintain the physical distancing so we don't have any contamination or cross-contamination issues. So we know we can't physically distance in that building, so that is our safest way of doing it. And again, that has been approved by the Grey Bruce Health Unit, as have all of our reopening plans. So we make sure that everything has been vetted by those who are in the know when it comes to making sure we're keeping our community safe. So Lori, if I may, I know we've had quite a number of questions having to do with the quarantine process, and also why people's materials have been on their accounts longer than the point of return. So when somebody returns a material to us, it used to be right then and there we would check it in. But because of decontamination and quarantine rules for libraries across the province and part of our plan, we treat everything with universal precautions. So that means that we identify and we handle every material as if it's contaminated with COVID. And that way we make sure that everybody's going to be safe. So what does this mean? That means that when you drop your items into the book return outside, we don't check them in. The next day in the morning, usually about 9:30, we bring in all of the materials and they're going to be put onto a shelf. And that shelf will sit for decontamination for between 3 and 4 days, depending on what the item is. So books are going to be 3 days, DVDs are 3 days, magazines are 4 days. And after that time has passed, and only after that time has passed, then our staff are going to return them. So if you were to drop off an item on a Sunday, when you're driving by one of our branches, on Monday morning, we're going to bring them into the building and place them onto the shelf and not touch them until Thursday. And then on Thursday morning, about the same time, 9:30 in the morning, that's when we check them in. So if you feel you've checked something in and it's still on your system, if you log in and check what you have out, don't panic. It has everything to do with the decontamination. Another piece you'll see with our service model is when you go to either of our branches, but it's most significantly seen here at Ellie Shore, when you walk in, you cannot go and browse the entire collection. And we understand that some people are disappointed that libraries are open and now you finally want to go and search the stacks for that book. But again, that has to do with making sure that there's no cross-contamination from one person onto the books and then another person taking that home with them. So we are pulling materials. If somebody has a book that they're looking for, or a DVD that you can't find, or an audiobook or anything else, we also have quite a number of displays. So throughout the buildings, we have forward-facing books and some book trees, and we have books in the windows. And at CHD, we have the same thing. Right when you walk in, we have quite a number of books that you can browse there safely. You can handle the materials briefly to see if it's something you've read, but it keeps us from knowing exactly what has been handled and knowing what would be safe for the rest of the public. So again, this is just one of the ways that we're trying to make sure that we keep our community safe and we do our part. And again, everything has been vetted by Grey Bruce Health Unit, so we're not making it up. We are working with vetted materials.
Can I ask a question of you, Sabrina? In terms of placing holds and picking them up, I know there's a time when you can only pick them up at certain times, but now I think it's probably whenever the library is open. Is that true?
That's correct. So if you place a hold, we do check our holds list a few times a day. You will get an email when your materials are ready to be picked up. And that will be at either branch now. So you can, again, pick up at the depot. I know everyone's very excited who were our depot hold pickup people before, because during the shutdown, when we had curbside, we were only doing that at Ellie Shore. So now if you place a hold, it will be available for you in some cases within an hour or so, but you will get that email. And if you don't have email, we do make a phone call, but we encourage everyone to register an email with us.
Okay, so you designate when you place your hold where you want to pick up, and you can also choose to drop off at either location.
That's correct.
Right. What about fines? What's happening with fines these days?
So in January, we did cancel all fines for our youth. And I know it didn't get a lot of fanfare because shortly thereafter, the pandemic hit and everything kind of shifted the way we were doing things anyways. But in January of 2020, we decided that children and teens should no longer be penalized for late returns. And in part, it's because, you know, kiddos don't have the ability to come to the library on their own half the time. They need transportation. So we didn't want them to feel nervous about coming back to their library. And it really was such a very small amount of fines that we were bringing in. But as part of our pandemic plan, we also made sure to cancel all fines for the foreseeable future. So this is for late materials. We realize that everybody is trying to be safe. They're trying to limit traffic, limit travel around, and many of our vulnerable sector are homebound because they don't want to go out and they're depending on their family and friends to return materials. So again, we don't want to penalize people for late materials. So we do ask you to bring them back as soon as you can, but this decision is our way of supporting the health in our community.
Nice. So what happens if we have to retrench? How do we know, what are the triggers, and do you know what steps we'd have to be taking?
Certainly. So we have all of our opening, reopening, and potentially backwards planning plans all in place. So ultimately, the decisions for any shutdown or any limitation of face-to-face services would be made externally by the ministry, like they did last time. Potentially, Grey Bruce Health Unit could be doing the same thing. They could tell us to change or shift or even stop a service. And of course, council could do the same thing should they choose to close any facilities in the future. None of those things are being discussed at this time, but we have made plans. If any of that does happen, we ran a very successful curbside pickup, so that would be our first step backwards. Any contingency plans and services would automatically be going up onto our services update in COVID-19 page. So we're really encouraging everybody to keep watching that. In the next week or so, I'll be putting up details about how CHD will be opening there. So although it felt like we didn't have a lot happening on that page for a few months, as things ramp up with the pandemic, we will be using that throughout this 15 months that we anticipate still having the virus around. So any changes, that's where we will be placing them. And we're going to, again, always be siding on the safest way of providing service to our community and working for our staff. So we're going to continue with the hybrid method of programs online, our face-to-face services being book, computer, and those types of things. And if anything needs to change, that's how we'll do it. We'll just roll it out that way.
You just said now booking computers. Can you talk a bit about how one does that, or how do you maintain the safety around people handling the keyboard?
So booking computers, we have two ways of doing it. If you have a computer or a phone or something at home, you can do it online. And of course, if you're coming here because you don't have that, we will also take those over the phone. We are booking them starting at the top of the hour. We have 2 computers that are available right now, and that's because of physical distancing. We've just limited what computer access there is. So we have 2 for 45-minute periods that you can have right here at Ellie Shore. The depot, when they are up and running in the next month, we'll have 1 available the same way. And then we also have 2 computers that are the Creator Space content. So if you are a Creator Space user and you've gone through the training on some of their platforms like their editing suite, they're now here in the Ellie Shore boardroom. So you can book any of those. And then we make sure that you are physically spaced. So we have 1 person really at each of our round tables here, and only 1 person at the depot, and a maximum of 2 people in the boardroom for the Creator Space. And we are booking all of these because of the amount of time that we need to guarantee the cleaning has been done. So between each person Everything is sanitized down. We are using a peroxide sanitizer that is the medical grade that we've been instructed to use. That's what we do all of our sanitizing with in both of the buildings. Part of that opening plan that was approved by Grey Bruce Health Unit. So keyboards are wiped down, the mouse is wiped down, the table is wiped down, the chair that you sat in is wiped down, and really it's the only chairs in either of our buildings. We have no tables for people to sit or study or congregate, and it's a loss for libraries, we know, not to be able to act as those hubs, but it is, again, for the safety of all of our community. If you are a Wi-Fi user and you have a device and you just want to piggyback on the Wi-Fi of Ellie Shore or CHD, we have adjusted all of our nodes so that they are now really pointing outside. So better access from the parking lots, better access from the picnic table at CHD, and better access in the courtyard of Ellie Shore if you'd like to sit in any of the Muskoka chairs out there. We do let everybody know, though, that the Muskoka chairs are not maintained by us. Being wood, it's much more difficult for us to get outside and inside and do those. So that is a use at your own risk, but wood does have one of the lowest transmission rates as well. And again, if you're using hand sanitizer and washing your hands, there should be no major issues with that because that is our best way of protecting ourselves.
I just wanted to point out as well that as a safety measure, you're also scanning people's library cards when they come in, and that's the best way to maintain a record of who's been in there and for contact tracing.
That's right. So contact tracing is something we hope we never have to use. But if you are a library card holder, then we will contact trace you just scanning your card, just like you're checking out a book. It goes into our system just like you've checked out a book, and it would only be retrieved if Grey Bruce Health Unit gives us a call and says there's a problem in the community and they're looking for people who are in the building from a date to another date. Other than that, you know, there's really no use in those. It will be purged when the pandemic is done. If you are not a library user, so let's say you're going to the museum and you don't have a library card, you're coming with guests or visitors, or you're coming into Ellie Shore for Wi-Fi as people are traveling through, or even if you're bringing someone to see the newest exhibit in the gallery. We are back to having exhibits in the gallery again, so excited about that. We do have a paper form, so it doesn't have to be a library user.
I see. Good. Thank you. What about the budget? Can you tell us a bit about the preparation for the 2021 budget?
Certainly. So the board has just passed the draft budget, which now gets passed on to council and will be included in the larger town budget process. So important to note is that when the board and I were working together on the budget for 2021, we made the decision to have it be a non-growth budget. So there is no increase to this budget. What that does mean is we are going to have some shortfalls in areas because we're not taking into account the extreme real estate changes that we've seen in our community as many people are choosing to purchase outside of the city and the new builds that we have coming in. And it also doesn't account for a really interesting shift that has happened as a result of the pandemic. And that is the many households that have moved from seasonal to full-time residents really overnight. So between April and June, many people decided this is where I'm now going to live full-time. We know that's not included in the budget, but we did that based on the financial constraints of the entire municipality because of the pandemic. We know that in 22, we're going to have to be looking at this new growth and doing some catch up, but we also know that the entire town is going to be doing that look. So there was some discussion already at council about this issue of the real estate change, the increase in our population, and it's something that's also being brought up at county council by our town representatives. So we'll be following that and working closely with the town staff and council to make sure that when they're ready to start addressing those needs throughout the town, we're at the table to have that conversation for how that impacts the library, museum services. Beyond the actual numbers of the budget, which I don't want to get into because we will have a very fulsome process through the town's budget program that's coming up in the coming months. There's a few things we just wanted to point out, and the big one is the interfunctional transfers. So the Council Committee of the Whole on June 30th, and we will post the policy there for you in case anybody is a policy wonk like myself and likes to read those things. But there was an update to the interfunctional transfer policy that happened at that Committee of Council. And what they did is they moved forward with some studies that they had started back in 2019, which was to look at how they could determine what the true cost of doing business was for each department. So they're not new costs. There's areas such as finance or IT or HR or legal, for example, that their budgets actually touch other departments. So the library has finance done by the town, a portion of our IT is done by the town, some of our HR is completed that way. Occasionally we use legal services. Certainly our facility maintenance is a big piece of that. So in the past, your budget would just be your personal operational pieces, and then facilities maintenance, for example, would have a whole section of lines that had to do with Ellie Shore and another group of lines that had to do with expenses of CHD. So what they've done now, based on this direction that Council gave in 2019, is they're doing interfunctional transfers as part of the budget, which means instead of looking at it at the end of the year, they're going to plan for it in the beginning of the year. It's no real new money because it was already in other budgets, but now it's going to align with the appropriate group. So when you look at the Blue Mountains Public Library budget, it will look like it has a very large increase, almost $400,000 increase. But the reality is it's what was already being covered in other budgets, and it's now being appropriately put into the right budgets, which really is a great budgeting practice. So we're happy to see that because that really makes sense to be able to say, what is the true cost of services? In actuality though, because we did go for a non-growth budget, we did make sure that our budget was in line with the 2020, and it actually decreased by just about $1,400. So not a big savings there, but it did not go up. And that's something that was really important when we understood that, you know, our entire community is being hit by what this pandemic means, whether it's jobs or just extra costs that you have now. And we certainly didn't want to have any type of increases to a budget, and the town is really trying to target for no tax increases themselves. So this is in line with what they were looking for.
Right. At the board, we talked about wanting to support the town in the approach it's taking, and so that's part of this approach. I also want to point out that the services you mentioned are also covered by our memorandum of understanding between the board and council. So it's clear exactly what services are provided by the town for us. Let me see. Should talk a bit about the board meetings under COVID. The board has been meeting virtually since, I guess, March. A meeting is considered open to the public if anyone interested in attending has access to login information. So you may request login information credentials by emailing the library CEO, and we ask that you do that at least 30 minutes before a meeting. Earlier is much better, simply because the technical needs just before meetings can be a bit demanding. So you may participate in virtual meetings the same way you used to participate in face-to-face ones. There's a section, public input to the agenda. It's open to anybody to speak to items on the agenda that day. There's also the opportunity to do deputations, as there always has been. So the requirements for these methods have not changed, and they're in our policy, which you can find on the policies page. It's called Meetings of the Board, and the page is meeting in an agenda under communicating with the board. So just want to remind people, you can send us questions if you want. We haven't seen any questions yet, so feel free to send some if you would like. So, I think you've got a couple of good news stories for us as well.
I do. We wanted to really focus on the work of the virtual branch. We have had such an uptick on people watching all of our videos and participating virtually with us that it almost is scary that when we come back out of this pandemic, how are we going to go back to only doing face-to-face? We have to figure this out in the future. Because we have so many more people participating with us right now than what we had even before the pandemic. That could be because people are now home and you're looking for things to do. But if you think of it as a story time that we would do for a group of children, might have had 10 kiddos that would come. Well, now those same 10 children are watching, but our videos are getting played over and over across the community. In our participating reciprocal agreement communities, we're seeing them. And I'll tell you that our videos have actually gotten quite technical. We're getting much better at them. Our very first video, we didn't take it down and we didn't edit it, but the first story time we realized that they had turned the tablet sideways. So you get to see Jen's head sideways for the first few minutes of the video. We don't make those mistakes anymore. We now have great we're using creator space equipment, so our cameras are fantastic, our microphones are good. The joys of being able to partner with a great technical makerspace. We've had lots of training now on how to do those things, and I think that we have some really good videos that are out there. We have thousands of views on all of our videos at this point. Some of them are on Facebook, going back over the month, re-looking at them. Some of them are on YouTube being viewed. So whatever your preference is, whether you want to watch live, whether you want to go back and find it later, or go to our YouTube channel. Even the board meetings will be there. Between the next board meeting, we'll have that up, and then when the next one comes up, we'll replace it so that we don't have a huge backlog of materials. But lots of really fun things that are there. So we just wanted to say kudos to our staff, and we certainly hope that you're using them and enjoying them, and feel free to spread them wide if you know of anybody else who might like that. If you have grandchildren who aren't in the area, send them the link or tell them to come to our page.
Great, good. I'd like to mention the COVID Alert app. You mentioned programming and lots of things showing up on our virtual programming. And one of them we will be doing this week, Wired Wednesday program, which will be happening on Wednesday at 2 p.m. on Facebook. And it's going to be about the COVID Alert app. Now, the app has been released by the government, and its point is to aid in contact tracing under COVID. So we will be doing this session to make sure that you understand how it protects privacy, as well as some of the practical questions about how to download it. I'd also say that BMPL is endorsing the app as a good tool in keeping our community safe. So if you're having questions about it, the Wired Wednesday session would be a good way to find out a lot more about how the app works. And I also want to offer a little reminder here. The town has issued a leisure activities plan survey, which closes on Friday. This survey is to take a look at the community's priorities in terms of any number of leisure activities, and library, museum, gallery services are part of the leisure activities in our community. So this is your opportunity to have input into the town planning around leisure activities. And there's no specific examples of libraries included in the survey itself, but there are comment opportunities throughout the survey. So you can certainly mention the library, museum, gallery as you go through the survey. So please take the time to take a look at this document and respond to it, because it will certainly influence the directions the town is going in the next few years. So I still haven't seen any questions from anybody, and unless they pop up very quickly, I think we will be wrapping up. Sabrina, unless there's something else you think we need to add?
No, and I think when we based our plan of what we wanted to talk about today, we used the general comments that had been coming into the library over the past weeks. So I think that we're good to move forward.
Great, good. And I see a little note here from our admin support that there are no questions. Ooh, just a compliment. How nice. So shall I read it? Excellent presentation of rules and regs for protecting everyone from viruses. Dr. Saunders very eloquently gave reassurance to all communities to the library's concern of keeping everyone safe and healthy. Well done, Sabrina.
Thank you. It is something that we're working on. We know we're in this as a community. We're watching some of the cases begin to increase in our area. So we all just have to do our best, and all of the library staff are here to support you. And if you have questions about COVID, we have reliable, valid resources that you can link right from our webpage, and the staff can help you find. No bad information. You know, we want to make sure everybody's getting what they need to make informed decisions about their own health.
Great, good. Well, thank you very much, and good night, everybody.
Good night.